Thanks, Don. So James Brophy and Margaret Keith both have PhDs in environmental health from the University of Stirling in Scotland. As a couple and as research partners, they have studied an extensive range of important occupational and environmental health issues. Both worked at the Sarnia Occupational Health Clinic for Ontario workers, where they helped to document one of the largest cohorts of asbestos-diseased workers in Canadian history, the industrial workers in Sarnia. They also assisted the First Nations community of the Aamjiwnaang in examining health problems that were hypothesized to be associated with environmental pollution arising from the petrochemical industry. Margaret was a co-author, along with Ada Lockridge, of an article that found a skewed birth ratio among the Aamjiwnaang community that generated international scientific attention. In 2008, they were recipients of the Gold Award in Environmental Health by Canadian Geographic for their work in assisting the Aamjiwnaang. So their new book that's just been published just last year, entitled Code White, Sounding the Alarm on Violence Against Healthcare Workers, draws heavily on three important research studies they conducted over the past 5 years. The first two focused on violence against staff in hospital and long-term care, and the third on healthcare worker protection during the pandemic. So over to you, Jim and Margaret, and they will be staying after the service for discussion. I'm sure some of us will have questions for them. So thank you, Jim and Margaret, for joining us this morning.
Thank you. Are we on? I guess we are, eh? Yeah.
Yes. Yeah.
So first, Margaret and I both want to say how pleased we are to be here. We want to thank you, Alan and Anne and Michael, for your kind words and invitation to participate. We want to warmly thank the whole Unitarian Fellowship of Sarnia, Port Huron, and Guelph for having us here this morning. As the prestigious New England Journal of Medicine said, healthcare workplace violence is an underreported, ubiquitous, and persistent problem that has been tolerated and largely ignored. We strongly believe that violence against healthcare workers is a human rights and social justice issue, one that is still widely hidden from the public. Just to show this book, we wrote this book, published by Between the Lines in September, to facilitate healthcare workers in sharing their experiences, to help give them voice. An important takeaway from what we are going to discuss today is that the well-being of healthcare workers is a useful barometer for the health of the healthcare system, both of which are in serious crisis. Violence against healthcare workers also reflects the many issues that remain unresolved in our broader society. Many of you will have heard about the incident last week in Sarnia. A troubled young man, likely under the influence of drugs, brought a BB gun into the Sarnia Hospital ER just after midnight, terrifying staff and patients and requiring police intervention. A hospital spokesperson, Julia Husserman, was quoted as saying, "We have noticed in general that tensions are pretty much at an all-time high overall in our community." This is far from an isolated incident.
So over the last 5 years, we found ourselves immersed in the subject we were completely in the dark about till we began this series of research studies with healthcare workers. The resulting 3 peer-reviewed journal articles and this book tell a story that must be told. It reveals secrets that we believe the healthcare industry and government regulators don't want us to know about. It wasn't until we began to explore this issue that we had any idea of the seriousness or widespread nature of the physical, verbal, and sexual violence that healthcare workers are facing on the job, many on a daily basis. I'm going to give you a sense of what we heard. On a daily basis, I'm hit, punched, spat at, sworn at, slapped, bitten. I've had hot coffee thrown at me. I've gone home with burns on my hands. I was just fixing a shoelace and he punched me in the back of the neck. I didn't see it coming. I put his pajamas on and I went to tie them. Then I saw his fist. Oh my God, here it comes, pow, right in the mouth. It cracked all my teeth and broke my nose. A patient on a medical unit who wasn't getting a cup of tea when he asked for it stabbed me in the arm. I've had my ribs broken when I was working in the emergency room and I was put through the wall because a patient didn't like to be told he wouldn't be given the drugs he asked for. I've had my leg severely broken. I've also had a chunk of flesh bitten from my body. I've had my head wrung, my jaw twisted around. I've had my family parts assaulted on many occasions. We also heard of many troubling incidents of brutal sexual assault and racially motivated abuse. We heard of careers ended and lives ruined because of devastating physical injuries and psychological trauma.
Recorded statistics underestimate the reality of violence against healthcare workers, largely because it is widespread underreporting, because there is, widespread underreporting of violent incidences. This was affirmed by the findings of the 2019 Federal Parliamentary Committee report. But looking at the numbers that are available, we see that out of all the occupational groups, healthcare workers bear the greatest risk of workplace violence. Between 2006 and 2015, there are over 16,000 violent-related lost time injuries among Canadian healthcare workers, compared to 7,500 among those in all non-occupational, non-healthcare occupations combined. In 2017, the Canadian Federation of Nurses Unions reported that 61% of the RNs surveyed experienced serious workplace violence, in contrast to 15% in the other industries. In 2017, the Ontario Council of Healthcare Unions, CUPE, commissioned a province-wide poll of their members to investigate the prevalence of violence perpetrated against hospital staff by patients. A total of 1,967 healthcare workers participated. According to the poll, 68% of the nurses and personal support workers had experienced at least one incidence in the past year of physical violence.
Before we undertook this research, we were also relatively unaware of just how seriously our healthcare system has been allowed to erode. In numerous polls, the majority of healthcare workers said that they're simply not able to provide proper care. The epidemic of violence is in many ways an escalation of the ongoing failure of health and safety regulatory oversight. It also underscores the chronic underfunding and increasing privatization of the healthcare sector. These problems are aptly illustrated in Ontario, where bed shortages, wait times, and understaffing plague the system. In 2019, the Canadian Centre for Policy Alternatives reported that Ontario was tied for last place with Mexico, having fewer hospital beds per capita than any of the developed countries they examined.
We undertook our research to understand the causes of violence and what is needed to prevent it. Over a period of 5 years, we spoke with hundreds of nurses, PSWs, kitchen staff, cleaners, and other allied workers. We learned that healthcare workers are suffering in silence from inadequate protections, overwork, exploitation, burnout, lack of respect, and from violence perpetrated against them. We learned that remaining silent is not their choice. It is imposed upon them by employers that threaten to discipline or fire them if they speak publicly about their concerns and their suffering.
I think it's important to note that the vast majority of healthcare workers are women, and many are racialized. Violence against healthcare workers is yet another manifestation of violence against women and racialized persons. And as we say in the book, we all need to be able to talk openly about such issues as violence, fear, discrimination, and burnout. Rebecca Solnit, who has written about the silencing of women as a form of control, said, "Being unable to tell your story is a living death. Violence against women is often against our voices and our stories. Silence is what allowed predators to rampage through the decades unchecked. having a voice is crucial. It's not all there is to human rights, but it's central to them. And so you can consider the history of women's rights and lack of rights as a history of silence and of the breaking of silence. To add insult to injury, literally, healthcare workers often feel blamed when they are assaulted. Post-incident debriefs often begin with their supervisor asking questions such as, how did you approach the patient? What was your tone of voice? This sounds uncomfortably like the way women have been made to feel by society when they have been victimized by violence, an injustice that is now being widely challenged. To add further to the harm that is done by the violence itself, many staff find themselves without adequate post-incident supports, leaving them to suffer emotionally, physically, and even financially.
We have also learned that the experts, the healthcare workers themselves, have provided a roadmap for regulators and administrators to follow. But they made it clear there are some serious barriers to be overcome before that can happen, such as the normalization of violence, the idea that it's just part of the job, the systemic underreporting of violent incidents, the lack of respect from patients, residents, and their visitors, and from higher status professionals and supervisors. They also cite poor communication and the threat of reprisal for speaking publicly as obstacles. The two issues that stood out for us as the most important and significant barriers to change are there is a lack of institutional and legislative acknowledgement of the enormity of the problem of violence against healthcare staff, and a corresponding lack of resources such as adequate funding, beds, staffing, appropriate facilities, preventative programs, and security measures. Furthermore, the problem has been effectively concealed from public scrutiny. As a result, there is little public pressure to change the conditions that lead to violence.
It was apparent to us after speaking with hundreds of healthcare workers that many of the risk factors for violence are modifiable. In other words, prevention can be accomplished. Ensuring adequate staffing levels, a strategy recommended in much of the published research literature, was cited and emphasized by workers in every interview we did. Engineering controls, such as better building design, better communication and identification strategies, increased security, and zero tolerance policies were also recommended. We've come to understand that prevention efforts need to address not only immediate safety concerns, but also underlying systemic causes such as gender and racial discrimination. While we were in the process of finishing the writing of Code White, the COVID pandemic arrived in Ontario, shedding even more light on the working conditions we had been documenting. As we wrote in the preface of the book, we've since learned, not unexpectedly, that the problems we had learned about only became worse when COVID hit. Hospital and long-term care workers had been facing serious challenges before the pandemic. Already overworked, burnt out, and demoralized, they now found themselves in the midst of a full-blown occupational health crisis in a system that did not have the resilience or resources to meet the greatly increased needs of patients, long-term care residents, or the people who care for them.
The pandemic has brought about a further degradation of working conditions. Increased staff shortages, stress, patient and resident frustration have led to an even greater risk of violence. Violence against healthcare workers, already a serious problem in hospitals and long-term care across the province, has been exacerbated by lockdowns, canceled programs, restrictions on visitors. One of the long-term care residents whose routine was changed because of the pandemic lashed out at a personal support worker. She told me, or us, there has always been a lot of violence with residents, especially when they have dementia. They can get very agitated or aggressive. This anger kept building up, and after a few weeks, he was at his max. He had been saying that he had already getting frustrated and someone needed to come in and figure out something for him. It didn't happen until I was punched in the face.
The fact that healthcare workers have not been given the equipment they need to protect them from being infected with COVID has created fear and frustration. Many told us they had requested N95 respirators, which are specifically designed for airborne protection, but were denied. As we wrote in an article early on in the pandemic, when viewed through the experiences of those on the front lines, the coronavirus response has been a series of failures. Failure to apply the precautionary principle, fundamental to public health. Failure to provide proper protections for workers. Failure to implement recommendations to improve worker health and safety. And failure to place human health before the economy. The lessons of the past are crucial to understanding what is happening now. Ontario's healthcare system and public health approaches under neoliberal austerity-driven cuts have dismantled an important part of our social safety net, and COVID has exposed the consequences. The Ontario Health Coalition has just released a statement calling for emergency measures to address the Ontario healthcare crisis. In it, they say inadequate funding and labor force restructuring have resulted in crushing workloads, insufficient staffing, and increasing violence have contributed to untenable rates of injury among healthcare staff. Planned underfunding, budget constraints, and legislated wage suppression turned the shortages into a crisis. In the pandemic, the staffing crisis has become a full-blown emergency made worse by inadequate personal protective equipment and safety protections for workers. For-profit privatization has exacerbated the deteriorating conditions.
The current healthcare crisis provokes a number of questions. What will the world look like after the pandemic? Will we be better prepared for the next one? Will healthcare workers be better protected? Will there be reinvestment to remedy the weakened public healthcare system? Will we have the moral decency to give the infirmed and the elderly the compassion and care they deserve? Are there lessons for broader precautionary measures for other critical healthcare threats or health threats, such as climate change? We clearly need a systems approach that sees beyond the individual to the collective nature of how we live, work, and play. The revamping of priorities away from the profit motive and towards the health and well-being of persons mandates the investment to improve the lives of everyone.
This book, Code White, is an uncomfortable book to read, but we believe it's an eye-opener that might just inspire its readers to start crying foul. The bottom line is that healthcare workers are being exploited. They don't have to be living and working in pain and fear. Violence can be prevented. COVID transmission to healthcare workers can be prevented. Failing to protect them is a form of violence in itself. As we wrote in Code White, it is our fervent hope that this book opens the doors of our healthcare institutions wide enough that we can hear the voices, the pleas of those who care for us when we are sick and weak and unable to look after ourselves. We can't ignore this issue any longer, just as we can't ignore domestic assault, discrimination, harassment, or sexual assault. Violence against healthcare staff is a human rights issue that we are all being challenged now to address. Thank you.